Hello, everyone, and welcome again to another Maths Talk. Today, we have a very special guest joining us. We have Dr. Rajashekar Reddi, Director, Neurology here at Max Super Specialty Hospital, Saket. Hello, Doctor.
Hello, everyone.
So, Doctor, thank you so much for joining us today and taking out time from your busy schedule. As we know, we are now in 2022 and we still have winters. January is a cold month, and as we have seen in winters, neurological issues, especially stroke, are on the rise. But emergencies can happen anytime to anyone. My first question to you is what is considered a neurological emergency?
Thank you. Thank you for having me here today, and it's a pleasure to be here. I want to start by telling everyone that neurological emergencies are often very self evident. One would clearly know what is happening to a person when it's a neurological problem. Mostly, you would see a person suddenly getting weak on one side of the body, or there is some slurring of speech, sometimes a visual problem. There would be something which would be quite apparent. So, you would, even a symptom like, for instance, if a person is suddenly confused or disoriented, that could be a emergency neurological issue which must be handled immediately. So, in the context of stroke, we use a mnemonic or an acronym called FAST. FAST is F for facial deviation, the face turns to one side. A is arm drift. So, if you put the person's arm out and if you see that the arm is weak or the person not able to lift his arm up, or if there's a drift of the arm. S is speech. So, if there's a change in his speech, if the person is not able to speak or is speaking incoherently or unclearly. And T is time. So, we say if these four symptoms are there, which is FAST, F-A-S-T, then don't waste time, be fast and reach a hospital as soon as you can. So, neurological emergencies are not only limited to these symptoms. I want to tell you, obviously, if somebody's become unconscious, that could be also a sign of a stroke. That could mean either a large amount of bleeding in the brain, or it might sometimes signify a lack of blood supply to the brain in a large area, and patients would become unconscious in that situation. And again, this is something that people should report to a hospital immediately with. So these are some of the symptoms that a person with a stroke can have. But other than this, if somebody, the important thing to understand here is that most of the symptoms come on very abruptly. So only in the case of people who wake up with these symptoms, when we call it a wake up stroke, is it different. So a person can go to bed completely normal at, say, at 10:30 at night and get up in the morning at 6 o'clock and not be able to move one side of the body. That's called a wake up stroke. And as you were mentioning, winters are a time when we tend to see more strokes. So this is possibly related to high blood pressure surges which happen in the morning. So we see that this can happen more in this kind of weather. And so we have to be more aware of these symptoms during this time of the year. So these are some of the symptoms that I mentioned. But like I said, it doesn't include all the symptoms. Some people can even have just visual disturbances, for instance, blurring of vision, balance issues, unsteadiness of gait. All these things can also be acute neurological emergency. And sometimes that mnemonic, which I said was FAST, is stretched to be fast. B would be balance, E would be eyes, F would be face, A would be arm, S would be speech, and T is time. So if you have a neurological emergency, be fast. Get to a hospital as soon as you can.
Thank you so much, Doctor. Doctor, now you said be fast, get to hospital as soon as you can. But when it comes to a neurological emergency, such as stroke itself, how does one select which hospital to go to? Is it about the distance, or are there specific places, establishments that you should aim for?
So that's another very important thing. I think that one needs to understand that these situations must be addressed as soon as possible. So the first and most important thing is how close your hospital is. Now, if you have a very good hospital which is nearby, I think that's the place one must get to as soon as you can. But also, so I can divide this into a few things. One, get to a place which is close by so you don't waste time, because time is brain. The longer we waste, the more likelihood of brain tissue getting damaged permanently and the chances of reversibility reducing. So you want to not go very far, but it is important to try and select hospitals which are stroke savvy and stroke ready, which means that they should have the infrastructure to deal with an acute stroke situation. And this would, by and large, include three major things. One, you must have a very good neurological service which can identify strokes and treat people immediately in the emergency. Two, there should be a backup of a neurointerventionist who can do endovascular studies immediately, and if such an emergency procedure is required, that can be conducted any time of the night. And three is a neurosurgical backup. Now, all these three are very important, and invariably, if these three facilities are available in a hospital, that hospital would have very, very good facilities in the emergency, as well as they would have a stroke unit which would take care of the patient after an event has happened. So these are the three things that I would require for a hospital to have. But like I said, get to the place as soon as you can and get to a good center. And I'm sure that it's not very hard these days to identify hospitals which have all these facilities.
Thank you so much, doctor. Doctor, now my question here is, you told us fast. When you see a sign of stroke, you have to act fast. But what are the other things a person needs to do when they see someone have the signs and symptoms of a stroke?
Right. So, like I was mentioning earlier, unlike cardiac emergencies, neurological emergencies cannot be taken care of at home. So, this emergency medication that can be administered at home in terms of somebody having a suspected cardiac issue is not something that one can do for neurological emergencies, such as a stroke. So, the reason this is that you cannot administer blood thinners at home to a person who's had a stroke, because there's a chance that that stroke may turn out to be a brain hemorrhage. In that case, a blood thinner would actually do damage to that person. So the whole idea is to try, like I said, identify a person with a problem. Do not waste time. Get in touch with the closest and the best hospital that is available and shift that patient for further care there. That would be the best thing that one can do for a patient in this situation.
So, doctor, you said that don't waste time, get as soon as possible. So, here the main question arises, should one drive or should they wait for the ambulance to arrive?
So I would imagine that if a person is ambulant, which means that he is able to walk and he can be helped into a car quickly, it would be probably better to get into their own vehicle and reach a hospital as soon as they can. And I say this because not all strokes are such that a patient is paralyzed. A stroke, for instance, if a person has just a visual disturbance and he's not able to see, or he has unsteadiness, but he is able to be helped by others and can be sat in a car, then I would imagine that the best thing to do is get them into a car, get them to the hospital sooner, because it would still take some time for the ambulance to arrive from a hospital, pick up the patient and bring him back to the hospital. Now, the reason I say this is that sometimes this is also in large cities when there's a lot of traffic, time could be wasted on the road. So first choice would be look at the patient. If the patient's clinical condition permits, get your own vehicle and get him into a hospital as soon as you can. In case the patient is grossly weak, he cannot be, for instance, carried into a car, or you can't actually transport him yourself, then it would be probably more prudent to get an ambulance. The ambulance services will have a doctor who can at least take care of the first aid that needs to be done in a patient who's in such a situation. They can assess the patient then and there, administer certain medications, for instance, to reduce blood pressure if it's remarkably high and things like that, and get the patient into the ambulance and get him to the hospital. And on the way, this ambulance would inform the hospital that this is the condition of the patient, this is what is required to be done in the emergency. So everybody in the emergency and the hospital is prepped for the patient, and when the patient arrives, immediately is given the best possible care.
Thank you so much, doctor. Doctor, earlier you said how to choose a hospital during an emergency. Now, just for my audience, if you could point out the points, what hospital is considered a stroke-ready hospital, and is Max a stroke-ready hospital?
So let me answer the second question first. Max is a stroke-ready hospital. It's probably the best stroke-ready hospital. We have every possible facility that is required for the treatment of these acute emergencies. And like I said, there are 3 or 4 things that one has to have. One, you have to have a very good emergency team. The emergency team here is extremely stroke-ready. The moment a suspected stroke arrives, they announce a stroke code. Now, the moment the stroke code is announced, it's announced to all over the hospital, to the concerned teams. They get a page immediately, and this includes the neurological team, the neurosurgical team, and the neurointerventionist team, and the the ICU teams. So all these people are immediately informed that a suspected patient with stroke has been brought to the emergency. and they all arrive at the emergency to assess the patient. And once an imaging is done, and if it is decided that this patient requires a particular therapy, that particular therapy is given to the patient at the earliest. Now, like I said, a stroke ready hospital must have a good emergency service, immediate neurological availability of doctors, neurosurgeons need to be available also, as well as neurointerventionists, and and technology, of course. You need to have an endovascular suite in which you can do procedures immediately. So all that is very important, and these are the things that are there in all stroke-ready hospitals. Following the treatment, the patient is shifted to a stroke ICU, which is manned by ICU intensivists as well as nursing staff who predominantly or almost always just take care of stroke patients. So they have the knowledge, the know-how to take care of all the requirements in this emergency situation.
Thank you so much, Doctor. Now, Doctor, any words for the viewers here about emergencies and how to deal with them?
So I think that it's important for everyone here to understand that stroke is now called a brain attack. I think that just like a heart attack, where the heart is affected, a brain attack is something in which the brain is affected. Now, the important thing I want to tell everybody here is that the brain is not as forgiving as the heart. In the heart attack scenario, one can actually afford to waste some time or lose some time and still be able to salvage a lot of cardiac tissue. The brain is unforgiving, and if you lose time, brain tissue is damaged permanently and does not recover. But the silver lining here is if you get to the correct place at the right time, treatment can be done and the patient can recover completely. So this is important for everybody to understand. It's important to spread this message to people around you, because as the population gets older, we have parents, and stroke can happen in all age groups, but it's usually the older people who are afflicted. So it's important to identify these people, get them into the hospital. If they are disabled after a stroke because of the lack of treatment or delayed treatment, then it's a burden on not only the family but society also, and the patient himself suffers a great deal. So it's important to do the right thing at the right time, and that's the message for everybody here today.
Thank you so much, Doctor. And before we leave, I'd like to tell my viewers that you can connect with the doctor calling on the number that is on your screen or clicking on the bit.ly link. If you have any questions, please note them in the comment section and we will get back to you. Once again, Doctor, thank you so much for joining us. And I hope everyone today knows that being ready for your brain attack is as important as any other emergency. And I'll see you in the next one.
Thank you, everyone. Thank you. Bye-bye.